another Healthy Equine Therapies live session. We have a really exciting topic to talk about with today and a really wonderful guest that I'm really excited to introduce to you. We're going to give a few more minutes, see if anyone kind of comes online, but let's find out where you're all from. So in your chat bubble there, let us know what part of the country you're from, or if you're an international guest here today. We're always excited to talk to new people and give them some knowledge on some new modalities that are going out in the equine industry. With that said, I'm going to introduce you today to Dr. Stephanie Crawford. Hi, Stephanie. How are you?
I'm great, Lauren. Thanks so much for having me. I'm excited to chat with you tonight.
It's going to be a good one, and thank you so much for attending. So I'm going to just kind of let everyone know who you are, what you're about, and what you do here in the equine industry here in particularly in Ontario. Yeah. So Dr. Stephanie Crawford is a registered chiropractor and certified animal chiropractor based in Southern Ontario. She owns and operates On Course Chiropractic, which she established in 2016. Dr. Crawford is a graduate of Trent University, where she completed her undergraduate studies, and the Canadian Memorial Chiropractor College, where she trained to become a doctor of chiropractics. She completed specialized postgraduate training with the Veterinary Chiropractic Learning Center to become a certified animal chiropractor and underwent additional testing to gain accreditations with the College of Animal Chiropractics. She is dedicated to lifelong learning in order to provide the best service to her patients and has attended numerous postgraduate training and certification courses. Steph's equestrian background includes over 20 years experience riding, competing, and coaching in the English disciplines. She held a working student position with biomechanics expert Mary Wanless, worked as a showgroom for Olympic level show jumpers, and even worked for 5 years as an equine veterinary assistant in practicing specializing in sport medicine. Her passion is to work with horses and, of course, riders of all disciplines to improve quality of life and performance. And when she's not doing all that, she's enjoying staying active in the great outdoors and spending time with her mare Busy and dog Jasper. And her and her partner Dan are very avid rock climbers. So you've got quite the full lifestyle there, Steph. You've done accomplished a lot, and you hit that outdoors. That's great.
Yeah. My goal in life has always been to just figure out how to spend more time around horses and in the barns. So I'm doing pretty well at that so far, and I'm enjoying
it. So, for sure. And I think everyone here today is going to totally agree with you. We'd rather be outdoors with our horses, whether we're running barrels or we're jumping cross rails or just going out for a nice leisurely stroll along the trail. We'd rather be there than we would anywhere else, especially work these days.
Yep. Indeed. Yeah. Even when it's too hot or too cold or too many flies or too rainy, it's still the best lifestyle, in my opinion.
Yeah, absolutely. Yeah, the flies this year have been horrible. And I'm like, again, everyone's going to agree. Like, they're just awful. And even right now, they're still like nipping at you. So I can only understand how the horses are so agitated with them.
Oh, it's awful.
We've got a lot of people on here already, Stephanie. They're from Niagara, Cambridge, Kitchener, Waterloo, Milton, Smithville. I think that's Collingwood, Seawood. So we're getting quite the demographic here. That's awesome. Thanks for everyone for attending. So what we're going to talk about today is new and exciting to me. And Stephanie was actually my coach and trainer for this course. And I'm really excited to introduce it to you all, the Graston Technique. And I think it's fairly new to the Canadian horse industry, which is super exciting. And a lot of people probably have seen us do it to horses, but don't really understand the whole mechanics behind it and what actually it does to benefit their horses. So it's, again, great to have you, Stephanie. I think we're going to get some great knowledge out there for everybody. And I think our schedules are about to get a little bit busier.
Brace myself.
Yeah, right.
It's been a busy season. I think all the horse professionals out there can agree. It's everyone is spending lots of time out in the barns, which is great. Hopefully after tonight, you'll have some new ideas about how to help your horses recover when they've been working after, what is possibly like a long, hard show season for them. So.
Yeah, and getting ready for the cold season, right? Keeping those
Yeah.
muscles and ligaments and tendons in check and conditioned properly for the long, cold winter that we are oh so looking forward to. All right. Well, one of the first things I wanted to know when I was getting into Graston and you were introducing it to me is there's this abbreviation out there that I had no idea what it was. It's IASTM. And I've seen it, I've heard it, but I had no idea what it was. And I know there's quite a few other people out there that don't know. So can you explain what it is and what it's used for?
Yeah, so the acronym stands for Instrument Assisted Soft Tissue Mobilization. So that's a bit of a mouthful. So we say IASTM for short. This is kind of a new term probably to the horse world in general, but in human rehab, it's a fairly common modality that's been used in, especially like physiotherapy and rehab circles and by chiropractors and massage therapists for quite some time now, actually. So it's really cool that it's kind of come into the horse industry now, because there's actually quite a lot of knowledge and research about its use just from the human side of things. So sorry, I'm just playing with my computer here. So basically, Graston Technique is a subcategory of instrument-assisted soft tissue therapies. There are other instruments out there, and Graston Technique is sort of a combination of the IASTM and functional exercises. So there's a technique to the application of it. So it's not just the instruments themselves. There's a technique as well. And Graston Technique, which is what we're specifically talking about today, is it's been used to treat all kinds of soft tissues. And when we say the word soft tissues, we basically mean all the parts of the body that kind of hold the skeleton together. So the muscles, the tendons, and the ligaments, and the fascia that kind of encloses all of the other tissues. So those are the soft tissues that we're talking about. And Graston is used to treat those different soft tissues in different disorders that can arise. And scar tissue would be the other, thing that can arise within those soft tissues that we might be treating with Graston Technique. And we use it to kind of relieve pain. We also use it to promote healing and just restore normal range of motion as well. So there's a bunch of different ways that we could use it and different situations where we might use it, from like a horse that's doing well and performing well, that we just are finding small restrictions in range of motion that we want to help with to enhance their performance, all the way down to a tendon or ligament that has been injured. And we actually want to promote better blood supply and better healing to that tissue, and better fiber alignment in the healing. So all those things we might do with soft tissue, with IASTM, with instrument assisted soft tissue therapies. And the way that we use it, do you want me to keep going a little bit onto just the way that we use it and how we might incorporate it into our practices?
Sure. Maybe you can just touch on how Graston came about, because obviously you're saying that there's a lot of different instruments out there, but specifically Graston has come out with their own. So how did Graston come about from like a human standpoint and then merge into the equine industry?
Yeah. So Graston as a company, like I said, they started out on the human side of things. And it basically came about after there was an athlete who had an injury, who was actually treating his own soft tissue injury. And it was a knee injury, I think, either a tendon or ligament injury. And he was using what they call cross fiber massage. And that's a type of massage where you sort of, if you picture a tendon like my hand, instead of going along the fibers, you're actually going across the fibers. to help mobilize the area, help move it around, help bring blood supply to the area. And that's something that we would often do in massage, but he was actually started doing it with a butter knife from his kitchen. And he discovered that his injury healed really, really quickly and really, really well. And that sort of spawned some investigation and research. There are different types of like instrument type therapies that go back a lot further than that. Like for instance, gua sha is a common one that a lot of people know about. I mean, it's not the first incidence of someone perhaps using something other than their hands to perform therapy, but Graston was one of the first companies to develop the instruments that they did. So the company developed 6 different instruments, and they're all different shapes and slightly different treatment edges on them, all to sort of accomplish different goals on different parts of the body. And now they've trained some, I think it's up in the like 70,000 practitioners on the human side of things. So that's a growing number. There's always Graston practitioner courses for humans. And that's how I first was trained in Graston, was treating people. And then more recently, they developed an equine division, and I had the opportunity to be an advisor when they were developing the course because of my horse background. And now I instruct for Graston as well, as perform Graston on horses and people as a part of my chiropractic treatments.
So it's only as of recently that Graston has merged into the equine side. So it's very new, and you're a pioneer of that section.
Yeah, it's really cool because I think that it's something that is really going to become a lot more well-known and popular in the next couple of years, just because it is such a valuable modality on the human rehab side. And like I said, we've already been doing so much research to see the different ways that instrument-assisted therapies can help people recover from different types of injuries. So, it just follows that, it can very easily be applied on the horse side of things too. And our horses are such amazing athletes that, and they really have very similar types of tissue and systems. So a lot of the stuff that we know already about how useful this type of therapy is, it just transfers right over into the horses.
Yeah, and that's one of the things that drew me in, is that it's something new, not too many other practitioners out there offering it, and it's obviously something that can complement the modality that we're already proficient in, like yourself, chiropractics, and as myself, massage therapy. So it's an interesting concept that you can utilize. I know you're going to get into a little bit more depth about it. So why don't you tell us how these instruments work with the functional exercise to achieve like the best results for horses of all different disciplines and work modality?
Sure. Yeah. So with Graston technique, like I said, it's a combination of functional exercises and the instrumented techniques themselves. And when we're talking about exercise, we're talking about there's just a little clip of me doing a bit of a scan through and some Graston work on a horse's hindquarters. So what I might do with this horse after is some specific exercises to get the horse firing those particular muscles. So we're not just talking about going out and lunging the horse, but we want to do either particular stretches or a particular strengthening exercises or muscle activation exercises to kind of cement the new range of motion that the horse may have after doing this type of work, or to show the horse like, hey, you can actually move with less pain in this range of motion now. So we want to do these functional exercises in order to cement the therapies that we're doing with the Graston technique. So we want to remove restrictions, get things moving, and then we want to show horses how we want them to move their bodies after the treatment.
Perfect. And you're not adding very much pressure, right? We want to kind of convey that to everybody. When we're using these instruments, it's actually quite a very light touch.
Yeah, it's obviously when people see the instruments, sometimes they might be a little bit wary, and that's very wise, because using an instrument like this could have the potential to cause harm, whether your patient is a horse or a person. So we do, Graston only sells their instruments to trained practitioners. So in order to get a set of Graston instruments, you have to already be an equine practitioner, so a massage therapist, chiro, physio, some other type of body worker with clinical hands-on experience. You already know how to palpate horses, how to work around them, how to monitor their response to what you're doing. And then from there, you go on to receive the training in how to apply Graston technique. And it is a lot of very superficial work. So you're moving the layers of muscle and fascia and getting them to glide over each other. And that doesn't really take too much pressure at all to get a really amazing result.
Yeah, and another thing, I'm watching the video here of yourself, but you're constantly switching out the instruments, but then you're also paying attention to what the horse is reacting to. So I know you were using one of the instruments there, the GT3, and you were getting a little bit of a reaction to it. The horse was kind of moving back and forth, and you kept looking up and looking at the horse to make sure everything was okay. So how do you know when to switch up those instruments, or which ones specifically are required for certain areas?
Yeah, that's a great question. So starting out, usually would go from like a broader, flatter surface to a smaller, more specific type of edge. So that big instrument that I'm using there, that looks like handlebars, that is a great one to start off with, because it covers a very broad area. So it's going to be quite gentle, but it allows the practitioner to scan through and feel what's going on in the tissues, and feel for any fibrous areas, any areas of restriction, or any areas that the horse might react to. And then if we do find an area that's a little bit tight that we want to work into more, then we can go to a smaller instrument that might just target that specific area a little bit better. And one of the great things about Graston that I've really enjoyed is that some of the instruments have a very small tip and a small edge, so you really can work into quite intricate areas as well. So it's not always just about getting mechanical advantage or just having something that you can use instead of your hands. It also, it allows you to work into some areas and some very fine fibers with a smaller treatment edge. Like if you have your instruments handy, Lauren, I'm just thinking about like the edge of GT3 or GT6. You can see how small the edges are, and then you might use those edges in really tiny areas, like around the joints in the knees or hocks, or around the TMJ, or in a small area that has some scar tissue, something like that.
Yeah, so the GT6 it has a little bit of a curved edge to it. You can kind of, it goes upside down there. And then the GT3 is a little bit more broadly pointed, as you can see with that one. That's what Stephanie was referring to.
Yeah, so you can almost see on the screen that it has a bit of a beveled edge to it. So it's not just like, it's much better than a butter knife in that it's been designed so that it has a flatter edge that is in contact with the horse, and then it just sort of bevels up a little bit. So it actually can really push tissue along a little bit like a snowplow would. Yeah, you can kind of see that on the screen there.
Yeah.
And that allows us to get some information from the instruments as well. And I don't know how have you been finding it, Lauren, using the instruments? Do you find you're getting some information from the instruments that you wouldn't necessarily pick up with your hands?
Yeah, absolutely. So I know every kind of practitioner has a different method to using them. So what I usually do is I'll do like a pre-evaluation with the horse, kind of skim my hands through over, and then kind of make a mental note where issues I was finding. Then I'll actually go through it and do a full body massage, keeping an idea of what areas I really had a hard time getting into, and then kind of matching them up with my initial evaluation. And that's when I go back and use the instruments. And it surprises me how many times I find something that my hands just missed. And it's not a lot, but it's just in whatever kind of direction. the tissues are going,
Mm-hmm.
or if something was a little deeper, then I could actually feel manually. So it's amazing. And I know that was going to kind of bring up my next question, even though I know the answer, is how do you know when you've reached something that's irregular under all those, that skin and tissue?
Yeah. So yeah, like one really cool thing about Graston that I was really amazed actually when I started using it, having been trained as a chiropractor and trained to use my hands to feel a lot of what's going on in joint motion, in muscle tissues and other soft tissues. When I started using the instruments, I realized you can actually, it's almost like um, a stethoscope type of effect, because you can actually feel little reverberations from the tissues coming back up into your hands. So when you're standing over an area, it might feel really smooth and soft, and then you'll get to something that just feels a little bit grittier, and that's a small restriction. So, and then you can sort of work at it from different angles, and sometimes it will just smooth out and disappear. So then, and that's why you can get that increased range of motion, because you can just get those, if there's any adhesions in the fascial fibers, once they get smoothed out, they can then slide across one another once again. And so you can get some really good increases in range of motion that way. So just sort of scanning through a lot of the time and feeling for those type of things. And then that would give me some information about where to focus in with maybe a smaller instrument.
Yeah. And going back to the video, I can actually play that again. But you started off with the GT4, and don't worry, everybody, we will go through all the instruments and all the abbreviations for them and let you know what each one does uniquely. But the GT4, which I can pull out here, is the main scanning tool. Right, this is the one we use mainly to see if we can find anything underlying, and it'll give us like that amplified notification that there's something in the area. So it's just this guy right here. I'll play that video again. I just played, and you'll see that Stephanie's using the GT4 at the beginning, and she's just kind of moving it in different ways. Now, when you were training me, you indicated you had to have almost like a 45-degree angle.
Mm-hmm.
And I know that a lot of the instruments you do that for, but why a 45-degree angle?
So that's kind of a two-part question. So one of the reasons we might use, and when Lauren says 45-degree angle, like if you imagine my hand is the skin, the way we come at the skin could be like, that would be like a 90-degree angle coming straight down into it. And then this would be our 45-degree angle. So we would be moving across the skin, or sometimes we would even go to maybe like a 60-degree angle. So fairly shallow. And part of that is just so that we can shear the tissues and slide them along each other. We don't want to be putting pressure straight down. We don't want to cause bruising or pain by just compressing the tissues. We actually want to shear across the tissues. And there actually has been some study to show our body cells are really weird and wonderful. And there's some studies that show that the angle at which you shear cells can actually affect their response. And a 45-degree angle, if you push on a fibroblast cell, one of those soft tissue cells that make up a lot of our connective tissue, you can get more of an electric response. So something called piezoelectricity, which is where mechanical force is actually translated into electricity and cellular energy. So there is some logic to the fact that we use that particular angle, but also like it's just a really good way to glide and slide those tissues. And we want to cause the layers of fascia to glide over one another. When they do that, it produces hyaluronic acid that lubricates the layers of tissue. So it makes for healthier movement patterns. So there's a couple different reasons why. And it all just comes down to like the comfort of the horse, and then the actual effectiveness of the mechanotransduction, that force that we're putting through the actual cells.
And all the instruments, because they vary in, like you said, beveled edges and things like that, they all have a different application in like you said, angle when we're putting it on the horses and using them.
Yeah.
But then we also have different kinds of strokes as well, right? With the instruments, do you kind of want to touch on what kind of strokes that we use and how it works and is effective for the horses?
Sure. Yeah, like I mentioned, when we do a treatment, kind of start from a broader scanning, like I'm doing right now in the video with the longer GT1 instrument, and then we'll move into some more specific treatment strokes. So we might do some fanning strokes where we're fanning across the tissue in different directions. And we might do some swiveling strokes if we really want to kind of target a particular trigger point or area of adhesion. We might do some twisting type motions or some scooping, some swiveling, something to move those tissues in a 3D way in different directions. So so you could have like a broader scanning stroke just to move tissues in the area, back to a very specific stroke that might go a little bit deeper into the tissues, just depending on the depth of the tissue we're trying to move and the reason that we're doing it. If we're trying to get blood perfusion and vascularization into a tendon or ligament, then we'll want to do some of that, like sort of more. I'm doing a really bad job of being dyslexic. I'm moving my hands around the screen
backwards.
But we might want to do more of sort of like that cross fiber, short little brushing strokes to bring blood flow and vascularization to a tendon or ligament. Or like if we're on a trigger point, we may want to just do some some gentle twisting around that area to kind of loosen up the tissue in that specific area. So it just depends a little bit on what we're trying to achieve. But there's lots of, like I said, there's lots of different shapes to the instruments and different reasons and ways we might use them.
Yeah, definitely have the different ways to process different needs for the horses with the different instruments. And it's a lot to take in, but once you kind of get for lack of a word or way of saying a handle on things, you really get some great benefits with the horses. And I find none of them really attest to it. They all seem to really enjoy it. And sometimes it just takes my massager, I'm sure you find in your chiropractics, it takes it to the next level. Like they're relaxed when they're enduring their body work, but then you go to use these instruments and they just like totally melt underneath them. I haven't had one yet that it was a little bit deterrent of using the instruments.
Yeah, I actually, for myself, I actually usually start out with them, especially with a new horse that I don't know. It's a really nice way to introduce myself to the horses because they do find that it feels really good. So it's actually, before I get poking and prodding too much and challenging the joints, I like to use it at the beginning just to kind of make friends with them.
Yeah, no, that's actually a really good point. Maybe I'll have to try that one out when I go introduce myself to a new client.
I'm sure your massage techniques feel really good to them anyway, so you probably got that in your back pocket versus my poking around and pushing and prodding.
I have to do that a little bit at the beginning, maybe not as direct as you do it, but it might be a little bit nicer to pull out a little bit of GT4 and then just do a little scanning down.
Win them over a little bit.
Yeah, win them over for sure. So we've talked about the different instruments, the different shapes, the different strokes, and the angles. What is the overall effect of a treatment with the Graston Technique instruments?
So overall, like the main things are for like there's a couple different main effects that we're trying to achieve. One of them, like I mentioned at the beginning, is pain relief. It feels good. It helps horses to relax and release endorphins. So it's working on that sort of basic level of pain relief that a lot of like hands-on modalities would anyways. But also you're restoring range of motion by working through the myofascial chains. One of our goals of treatment would be to work up through the fascial chain. And by that, I mean, like, say you have an injury in one area, part of what Graston Technique teaches is to think about the body as a whole, and move into that myofascial chain. So everything's connected by fascia in the body. So nothing really is independent of the rest of the body. So if there's a problem in one area, we want to think about how those that lesion is going to affect the motion of the limb nearby, how it's going to affect the motion of the spine, how it's going to affect the fascial chains that are attached to it. So the, one of the main goals of treatment is just to ensure that whole myofascial chain is moving as well as it can be. So you have that pain relief factor, and then you have the sort of like range of motion factor, and then like some of your other goals. And what Graston might be doing in certain situations is actually helping, like I said, to bring blood flow to the area, not only by stimulating the tissues, but actually there's been some studies to show that cross fiber type massage with those beveled edges of the instruments can actually help new blood vessels grow in healing injuries. So like in humans, there's been some study of tendon and ligament healing injuries where you're actually getting new blood vessels to grow in the area more so than if there was no treatment. So that could be a goal of treatment, in certain cases of injuries as well. So yeah, that's, I don't know if I went a little bit off track from your question, but those would be some of the like goals of treatment of what it's actually doing.
Perfect. And then to follow that up, Christy has a great question here. She said, is Graston strictly body, or can it be used on legs for, say, a bowed tendon to promote healing? Do you want to touch on
that is a really good question. So the short answer is that because this is such a new modality in horses, it hasn't been investigated yet. There's not been any studies done on this. In the human realm, there have been. Most of the studies that have been done on instrument-assisted therapies have been done on tendon and ligament healing. So some of the early research that was done was on, they took poor little rats and gave them MCL tears. So in their knees, the collateral ligament of the knee, and then they used Graston to treat it with that sort of like cross fiber technique. And the healing of the ligament was really good. It healed with better fiber alignment. They, like I said, the blood vascularization was improved. So there was really significant healing properties. And that's something that, in the human realm is quite common to use Graston for those type of things, and tendon injuries as well. In horses, like I said, it needs to be investigated. And right now when we teach the course, we are not teaching people how to treat tendon and ligament injuries with the instruments, but I do think there's a lot of potential for Graston to be used in conjunction with other modalities as something that could help with tendon and ligament healing. So yeah, I think it's an area that I'm really excited to see some investigation be done, and to see it started to be implemented.
Yeah, so even though it's not ailment specific, you can actually use it on the lower limbs as well. I'm going to put a video up here of you working on a lower limb of a horse. So even though it's not specific to like Christy's question about like bowed tendons, you can still use it within those extremities there, correct?
Yes, absolutely. Yeah. And again, like we try to think about the whole chain as well. So on this horse, she actually has a big scar on her extensor tendon. I don't know how clearly it's coming through. So what I'm actually doing in this video is mobilizing some scar tissue around the extensor tendon. It's an old, just one of those old gnarly healed scars. So we're just trying to ensure all the tissues can slide really well. And she actually really liked it. She was, it often feels good to have those old scars mobilized. Actually, I think they get a little bit itchy, and they really like it. But anyways, yeah, we can use the instruments down the legs for sure. And then we would want to work up that myofascial chain. So in her case, up the extensor tendon, and then later up the gastrocs and into some of those larger muscle groups that control the extension, that extensor tendon.
Yeah, so even though it's not specific to, I know you're doing the extensor tendon, but it also has an indirect effect with other ligaments and tendons in the vicinity, right? So
for sure, yeah. And if I did have a horse that had a bowed tendon, like part of what I would want to do to help that horse recover quickly would be to incorporate stretching and exercises for the rest of that chain. So like say if it was in a forelimb, like you would want to be stretching out the shoulder and making sure those bigger muscle groups higher up are moving well. And Graston therapy would be a great way to sort of treat any secondary tightness that would come up through the shoulder after having a tendon injury. So that is definitely something that we would teach practitioners how to do right off the bat. And then, like I said, there might be some more specific applications for treating the actual injury as well.
And something to maybe bring to everybody's forefront too is that this modality is ultimately safe, even though, you know, you're using this surgical stainless steel apparatus and they've got all different kind of edging on them and whatnot. They're ultimately safe to be used for the horses, correct?
Yeah, there's very few cases of like again, I'm speaking mostly in the human side of things just because that's where it's been used extensively. But there's very few incidences of side effects or anything really going wrong with the use of the instruments. If it does go wrong, it's usually that it might be used, maybe not by a physiotherapist, by like an athletic trainer or someone who's really gone and pushed too hard and caused some bruising. But even in that case, like it's just temporary, it'll go away. In the horses, the practitioners are trained to be extremely careful about how much pressure we use, because we know that like we wouldn't be able to see if a horse did develop any bruising in an area. So when we're using the instruments, we are trained to use specific techniques that are extremely safe. I just, like, from my own personal experience, I haven't had any real cases of like any, excess tenderness or side effects or stiffness or, any bad results from using Graston. But again, it's something that should be in the hands of a trained practitioner. I wouldn't want anyone going out to use a metal instrument to try and mobilize the horse's tissue unless they were really well trained in anatomy and palpation and how to use the instruments properly.
And like you said, for the actual training component for all those, bodywork practitioners that are joining us this evening, it's a quite intensive training format that they have. I think I did about a 3-hour webinar that kind of had you review everything and go back and you had to be acknowledged that I had actually completed it before the course. And then I think we did about an 9-hour day at the barn where you oversaw everybody using the techniques and kind of just giving your insight and feedback to everybody as well. So it's not for the faint of heart for sure, but it's worth every penny that goes into the Graston Technique course for sure.
Yeah. And for all of Lauren's clients, will already know this, but Lauren is extremely studious, and she came to the training with about like 20 pages of notes, which is I was really impressed by. And we try to keep the groups small in the training so we can have a lot of hands-on corrections, because it really is gaining a feel of, it's an art just like any other type of body work, gaining a feel of how to use them and get the most out of them.
We only had 3 other attendees that day, but it made it a little bit more personal because we all came from different backgrounds. So we were able to share each other's knowledge, but having you there to kind of oversee what we're doing and give you the suggestions was insightful. And you also found things that maybe we didn't find initially and when we were scanning, and then you would let us kind of use the instruments and find it, and then we'd kind of have a great discussion about it. So it was a very lengthy day, and I'm sure you were tired as much as we were, but it was so informative that it was almost giddy for me to get home and start using the instruments. I think I really took them out to the next day. So it's definitely worth any of those practitioners out there to look into the Graston Technique, and you can check out their website. I think it's Graston Technique Equine.
It's GTEquine.com is the horse side of things, and then GrastonTechnique.com is the overarching Graston website for people.
Perfect. Yeah. Great websites to check out. And the people at Graston are totally approachable. The customer service is amazing there. And they've got quite the Southern accent from down in the States. So that's quite enjoyable when you're picking up the phone and talking with them as well.
Yeah, they're only based in Illinois, but they do have some Southern hospitality.
Right? That little Southern twang that comes up every once in a while is quite enjoyable. So why don't we jump into talking about each of the instruments now? I know when I show them to clients, they look a little intimidating, right? They're quite heavy in weight. They need to be to amplify everything.
That's right.
But there's so many different, like you said, edges that are to them that they can be very confusing and a little bit boisterous to some people. So why don't we have a little bit of a look at some of them, and you can kind of just give us the details about it. So I'll try and bring up the picture here, but I'll give a little bit of a Vanna White demo of the GT1. How does that sound? We'll see if it fits on the screen. So this is.
So the lovely Lauren is holding up the GT1. So that is the treatment edge is actually sort of in the middle. There's like 2 handlebars on the outside, and then that concave area that's facing up is it actually has a little bit of a beveled edge on it, so it's not completely round. So like I said, that you can use to sort of shear and push the tissues a little bit, and that's what gives you that really good feedback to your hands. And then it also has a couple of knobs on it, which are like the pointed, like the bottoms of the W, so to speak. And you can actually use those as like a way to maybe do some like trigger point therapy in larger muscles on horses, like the gluteals and hamstrings. So there's a couple different ways you can use that one.
So what specific muscle groups would you use this on? I know you said like the
yeah, so typically like obviously the larger muscle groups are really appropriate. By the way, these instruments were designed for people, and when we started to develop the equine side of things, we talked about like they were willing to go back to the drawing board and actually create new instruments for horses because they thought they might actually need to make bigger instruments. But it turns out that the 6 original Graston instruments are like already perfect and really useful for treating horses.
These instruments were made for people, but the shape of them actually.
There's me talking about the same thing. So yeah, here I'm just scanning through some gluteals. So definitely the large muscle groups, this GT1 instrument works perfectly for it. Contours really nicely to their bums and their hamstrings. And if they're chunky like this guy, you could even use them on the long back muscles a little bit. And then I could also use, sometimes I'll scan down the bottom of the neck with this instrument as well. But yeah, basically any big rounded surface is great, fits really great with the GT1.
And again, we're not using much pressure whatsoever. We're just kind of skimming the surface of the skin, so to speak. And they love it. They love the GT1 because again, it's just that big muscle group that you're focusing on, and they just melt underneath it. So it's not too intimidating to them. I mean, when we pull it out of our cases and things like that, it looks quite the instrument. But
that big broad surface is very comfortable and it feels really good.
I think I have another photo or video here that's about to pop up to show you about. Yeah. Oh, we got some birds this time. But like you can just tell that this
horse was like loving this. He was very happy. He was also very itchy, I think, so it kind of serves a double purpose sometimes to give them a little bit of a scratch. You can see he's just getting right into it. So that's just an example of me scanning through the neck with the same instrument.
Now, so to speak, the musculature plays a role in what instruments we use. So there might be those skinnier necked horses that don't have that lean muscle tone, that we would use it on their neck, right? That we'd pick something else out of our bag of tricks, so to speak.
Exactly. Yeah, it's a little bit of like a game of Tetris, just trying to pick the shapes that fit together well.
It is. It's fun. Yeah, you can see Stephanie just went from the shoulder up the neck and then back down to the shoulder, the tricep.
So this would be like very typical of sort of like the beginning of what I would do is I'm just scanning through all the different areas just to see what's tight, see how the horse is reacting. And on this horse, because he's quite round, I'm sort of going into his thorax area because it's still still contours fairly well to him there. And he was like rocking back and forth. He was really into it.
I was working on a gelding the other day and I was using the GT1 on his glutes and he was like literally just shoved right into me. I mean, if he had used any more force, he probably would have knocked me over, but he was like, he was totally into it.
Yeah. And with these broad instruments, they will lean into it a little bit and kind of increase the force to their comfort level. And because it's so broad, it's, it's really, even though it's large and kind of medieval looking, it's actually like a very large contact surface area. So sometimes let the horse sort of decide how much pressure they want.
Yeah. Look at that. He's totally into it. That pointy nose, those doughy eyes. Oh yeah, he's really getting into it. Let's see. And those are the types of reactions that we get out of using the instruments. Like I said, I haven't had a horse balk at it or get worried when I use it or have any kind of reaction. Just always a positive, happy reaction. To using them. All right, so that's the GT1. That's what the big guns essentially. And then we have the GT2. Where are you? I had them organized. There she is. So this unique tool.
Yeah. And the numbering, it doesn't exactly go from like biggest to smallest or anything. But the GT2, you can see it has a couple of treatment edges. It has 2 concave areas, one on each side. And each of those actually has a different type of beveled edge on it. So you can get a little bit of a different feel through the instrument, just depending on what side you use. And then the tips of GT2, we can also use to get into sort of some of that like swiveling and twisting that I was talking about to maybe get into smaller trigger point.
Yeah, so there you are using the GT2 and using that little bit of a swivel technique. So I know you use the instrument like so, but I know you can also use it with your hands. You're kind of putting a little bit more pressure on
That's right. Yeah. Yeah, so there's a couple different ways you could hold them, but basically I'm using the tip of the instrument just sort of in between in this horse, she had a bit of a ropey sort of fibrous adhesions in her neck around the groove between the 2 muscles there. So I'm just using that to kind of swivel in between the different muscle fibers just to help mobilize in that small area.
And then with the other 2 areas, you said they're beveled. Now they're 2 different kind of bevels, right? You want to kind of review that. So
yeah,
it's a double bevel.
That's right. Yeah. So, and that just means that like, instead of being flat, I'm doing the thing with my hands again. Oh my gosh. I can't look at myself while I do this. Instead of being like flat and then with a bevel coming up out of it, the double bevel is actually kind of, oh my gosh, why am I trying to do this with my hands? A single bevel would kind of be like this. It would be flat on one side and then beveled on the other. The double bevel is a bit softer. You could actually use it going either direction. So you could basically be scanning across and then just flip it and change direction. So you can kind of swivel back and forth with it that way. And then it just means that you can hold it in different manners. You can use both sides of the bevel.
Yeah, or a smaller toned muscle that kind of protrudes a little bit. I find that one works really well, like up at the pole.
Yes. Yeah, for sure.
Yeah. And then just to show them, I don't know if they'll be able to see, but this is that single bevel that Stephanie was referring to. So if you kind of see, it's got a little bit of an edge at the bottom there, where the double bevel is pretty much completely concaved. So it has a more surface area when it touched, where this is more a little bit broader on the tip.
Yeah. So yeah, and again, like you'd use that on like Lauren was saying, a smaller area where those smaller curves would contour well. So like the forearms of the front of the forelimbs up at the pole are like common areas where I would use that, or like down into the lower legs a little bit.
Yeah, for sure. And then we have, this is probably one of my favorites, is the GT3.
Yeah. So one actually kind of resembles a butter knife a little bit. And the treatment edge is just on the tip of it. So we only ever use the rounded tip that you can see pointing down right now. So that's where the beveled edge is. So that's a really good, useful instrument to kind of do some brushing across, like some cross fiber type massage, or getting into some trigger points, or just sort of scanning through smaller areas, like down into some, more tendinous areas, or just around more sensitive areas, like the top of the horse's poll, that type of thing. So, or like here in this example on this horse, I'm just using it, just coming off the spinous processes of the back, just to kind of push those tissues along. So just to kind of feel some of those smaller areas to scan through.
Yeah. It gives more a direct contact, and more specific area to work in. So it's definitely one of my favorites that I use, especially going through the spinous processes, or, into any kind of tight knit area or something that needs to be kind of elevated, to get some more myofascial release.
Yeah, that's right.
Yeah, definitely one of my go-tos. You totally lean into that hip there. And again, they don't, even as you get supposed to specific towards those bony premises, they don't really have a bad reaction to it. They really do quite like it. And of course, you just, that light touch again, you're not using it going deep into any kind of tissues or causing any bruising or anything like that.
That's exactly right. Yeah. Yeah. And if always just keep an eye on the horses. Like if a smaller instrument isn't working for that horse, then I can just go back to a broader instrument and still get a good result.
Yep, absolutely. Here's another GT3 at the top of the neck. Let's have a little look at that one too, because it works great up towards the pole as well.
Yeah, so here I'm just sort of framing out around the edge of the top cervical vertebrae. So the wing of the atlas, that's quite a wide bone. So it comes down from the ears and kind of wraps around. So I'm just using the instrument to sort of feel along the edge of it where there's some different muscle attachments. And in sport horses, it's a common area for them to have a lot of tightness. So it's nice to be able to kind of work into some of those specific small areas of those tiny muscles right up at the pole, just to help release them. And I find that a really useful area to use the Graston instruments, just because they can get, there's a big nuchal ligament that attaches up in there, which can become fibrous, and there's a lot of smaller muscles. So using the smaller instruments, you can sometimes get into little areas and help release, in addition to what you're doing with your hands.
So would you, for say the pole area or in those top cervicals, would you do the adjustment first and then go back and use the GT3 to kind of get into the tighter areas and see how that worked? Or would you do the GT3 and then do the adjustment?
I think that's a very individual question. Probably different practitioners would do it different ways. And I think there's a lot of different ways to incorporate, just depending on what type of, other type of therapies you already do, you might decide to do it different ways. I personally like to do the soft tissue work first, because it allows me to get a really good feel of how the horse is reacting in the area. I have a really good feel through all the muscles, warm the area up a little bit and help the tissues to relax. And then I find when I go in and adjust, the adjustments work a little bit better. The horse is already a little bit more relaxed. The area is nice and warmed up. So I feel like, for me, I prefer to do that, and then do a little bit of adjusting. But I know some chiropractors like to do the opposite, where they would go in and adjust first to help the soft tissues to relax. And then they would go in and do some more focused soft tissue work. So it definitely could work either way. And then, like I said, different practitioners might have different ways they would want to incorporate it. But really, at that point, it's up to just the expertise of the person working on the horse and what they're feeling and what they feel is suitable.
So just a personal preference and what they feel the horse would benefit from the most.
Yeah, exactly. Yeah. If the horse is a little bit worried about like having, especially if it's a sensitive area like the pole and the horse is a little head shy, sometimes it's nice to do some of that like slow soft tissue work before you go in and try and mobilize and adjust too much. So yeah, again, it just depends on the individual situation too.
Perfect. Now, GT4, the boomerang kind of looking one, the one we do the most scanning with.
Yeah, it's kind of like the most versatile instrument, this one, just because you can use it on tissues that are convex and concave. So the treatment edge is pointing up on, or it was a second ago, on one screen. So it's the beveled, the concave part of the instrument. The back of it, the straight part, is not a treatment edge. So it's just beveled on the one side. But you can use that to get into hollowed areas, as well as you can use it over like rounded areas like that chubby Appaloosa. Like I could use that on his like more rounded areas as well. Or if you have a horse that has some hollowed out areas like the neck in front of the shoulder often, or back behind the withers, then this instrument will contour to the skin nicely in those areas. I think this is going to be a GT. Oh no, sorry, I'm getting ahead of myself.
I think yeah. Sorry, it's a
little
jittery.
This is one of our instructors from down in the States. She's in North Carolina, I think. Sorry, I should have like maybe had this one cropped down a little bit. You might want to skip forward. I'm not sure how long she chats for.
See what we can do here. A little jittery on this end. I don't know if it's coming through okay on your end.
It's a bit jittery on my end too.
Oh,
there she's holding the instrument. So I think she's just going to be working along the paraspinals of this horse. So again, this would be a very typical thing that I would do before I adjust a horse to help everything relax a little bit. And also just to kind of scan through and see where those muscles are tight and possibly where the horse is a little bit tender and reactive. But you're going to see in a minute here once, if the video doesn't break up too much, she's going to scan in all different directions. So she's just feeling how those tissues are gliding in all different directions, from front to back, from back to front, and just having a really good feel through and a scan. And like I said, at the same time, that's going to be having some good mobilization effects on the superficial tissues like the fascia below the skin. And it's going to feel good to the horse and start to release some of those feel good endorphins. And it's just going to help the area warm up a little bit and get some blood flow to the area. Yeah, that one's a little bit choppy for some reason.
Yeah, let's see if I can.
Hopefully, you guys get the idea.
Let's see if I can find the other. It might be just a picture, I believe you sent me, but it might give everyone a little bit of an idea. Although I'm pretty sure quite a few people have seen us use the GT4 before.
Yeah, it's usually my go-to when if I'm just pulling a couple instruments out.
There it is. It's definitely the VIP of the Graston Technique.
Yeah, for sure. Yeah, in my in my practice, it is for sure. It just works really well on like so many different areas of the horse. It's very versatile. So you can see there, I'm just you can see it just like putting a little bit of pressure into the very like soft muscles around the shoulder there. And you can see like on this horse he's got quite a bit of fat coverage, so it's not like it's a really hollowed out area for this horse, but on that superficial angle still works really nicely.
Yeah, it's definitely like my go-to. It's if I need a little bit of more contact to be able to feel something, it's easier to find, and it's also the one I use after I've done a protocol of some sort, and then I can go back with this one and just kind of have a feel to see if I've missed anything or if everything's a little bit more relaxed and put where it's supposed to be put.
Yeah, I love that you're going back and like scanning through and reassessing the tissue after you treat. That's really, it's a great way to use the instruments. It's super important.
For sure. And then I call this one the oddball because I don't really use this one very much, but I did pull it out the other day. But this is the GT5.
Yeah, so that one, the treatment edge is on the bottom, so facing towards the bottom of Lauren's screen. So it's the opposite of GT4, so it's actually like a concave surface. So like that makes it, it's really good for contouring around, like say like the base of the neck, scanning through, or some of the areas where you would use GT1, the one with the handlebars, because it's actually the same shape of treatment edge, but this one has actually the bevel on it is a little bit sharper. So you can go in and get a bit more shearing force if you desire that, than the GT1, which is a little bit more rounded. So here I'm just kind of using it over the edge of a shoulder on, like, again, a fairly well endowed horse. All my horses are well fed, all my horse clients here. And again, you could use it to scan through that area. You could also use it, the way it was originally designed was for use on the rib cage in humans. So it contours really well around our own ribs to get into those, what we call the intercostal spaces. So the spaces in between the ribs. And we can actually do that on horses a little bit as well with this instrument. So yeah, those are a few ways we might use it.
That's interesting. I never thought about using that in those intercostals. I always kind of take out the GT3 and use that as a lighter touch, but I can see how this one would work.
Yeah, give it a try. Maybe you'll get to like it more.
Even I'm still learning about this new technique on the market. And last but not least, we have the GT6 little minion here.
Yeah.
So how does this one differ from the GT2? Because I get that asked all the time. So there's the top one's the GT2, and then you've got the GT6.
So it's a bit of a mini me, and it also has the same characteristics of having a double beveled edge on one side and a single beveled edge on the other side. But you'll also see the tip of it is a little bit different. So on one side, you have a pointy tip, and that actually has a bevel on it as well. And you can use that to treat really tiny areas. So there's just a bit of a close up of it. So on the right-hand side of the screen, you can use that pointy tip to get into doing some cross fiber massage in some very small areas. It's even smaller than that butter knife shaped instrument, the GT3. And on the other side, you can see it has a little bit of a hook. So you can actually use that to swivel or do some deeper mobilization in really tiny areas as well. So you can use both the ends of the instrument as well as areas that are just a little bit smaller in curvature, that you like, maybe more so in the lower limbs, or just areas that are a little bit smaller, that you want to sort of just, Tetris match it up to, again, like the contours of the body.
Now I know when we did the training, you said this one, the GT6 and the GT3 were really great for helping with scar tissue.
That's right. Yeah.
Really great video of you here working on some scarring aspects. Let me see if I can just pull that up so everyone can kind of see what you're doing here. So that's the GT4 you've got going, right? You're just scanning right now.
And then if you skip forward in the video, maybe closer towards the end, you'll probably see, again, like I always like to scan through with a broader surface first and then move into a little bit more specific treatment. So this horse, you can't see it super well on the video, but this horse had a scar along her back where the saddle sat, and I'm sort of pointing it out with my finger there. And it was getting to the point where like the wound had healed and she was being ridden again. But over time, it seemed to be getting more and more irritating for her, just having the scar under the saddle area. And she was starting to get kind of crabby about being saddled, and about being brushed in that area. So you could tell it was just starting to kind of bug her more and more over time. And the scar itself, when we first started working on it, was quite raised up. Unfortunately, you can't see it too well on the video, but you can kind of see it there. So I did a Graston treatment on it, and basically all I'm doing is I'm not trying to break up any tissues. I'm not really getting in there aggressively. I'm just pushing along the edge of the scar with that beveled edge of GT3. So I'm introducing a little bit of just a shearing force around the tissues. I'm going to push in all different directions, and I'm just mobilizing the tissue in the area. And I got a message from her, like, I think it was like the next day. And she was like, the scar had been a little bit raised and it just like flattened out overnight. It was so cool. And then we did like over subsequent like chiropractic treatments over the next couple months. We just did a little bit of Graston on it every time I saw her. And it was just a couple minutes each time. Like this whole treatment that you're seeing was just like the length of this video. That's all I did. So like maybe like less than 5 minutes probably. And then, and it just kind of flattened out. And then like by the third time I'd worked on it, there was basically nothing left of it. And I actually saw this horse the other day and I couldn't even find the scar. So it was really successful. Like kind of one of those things where you went in and, it was getting worse and worse. And like overnight, it was just way better. And it really helped that horse's quality of life, obviously, and her continuing her training under saddle.
So even though you applied this, can the horse be ridden the next day? Because obviously this is on the back. It's a very sensitive area. It obviously makes.
Yeah. I probably recommended her that she gave her a day or two just to get back to normal again in case there was any tenderness in the area. Sometimes there can be with any massage or chiro, but I wouldn't say like the risks after Graston would be anything more than like a normal massage or chiropractic treatment. For that particular thing, like if you're working on a sore area or a healing wound or something like that, then you would want to be a little bit, more sort of careful, I guess, and give them a little bit more time. But like basically, just whatever you would give for a normal treatment would also apply to Graston, unless it, like I said, it's something right where the saddle goes or something that's a little more tender when you're working through it.
Yeah. So I guess that leads me into one of my last questions, but so you've worked on the horse, you've performed the Graston technique. What would be the next step for clients to do so that they get the most out of their horse's bodywork and Graston experience?
Right. Yeah. So usually I'm sure Lauren is the same, but I always give people exercises to do with their horses that are going to help with their specific condition that we're working on. So there's, that hour that we're there at the appointment, we can get some things to start moving, but really at the end of the day, what is done between the appointments can make a really big difference in how the horse recovers. So we do want to give you some specific exercises to do in order to sort of like make the most of the gains that we got through the soft tissue work, and just to help the horse's neuromuscular strength and mobility. So like a typical exercises that we might give would be for doing some like horse strengthening work. So this is like me doing a carrot stretch. That's my horse Busy, by the way. I feel like that's important to note. She's the best. And she's very good at carrot stretches. Here we're just like stretching the front legs out. So if there was, again, like a tendon injury, shoulder tightness, even tightness up the lats into the lower traps in the back, we would want you stretching out that whole myofascial chain. So we're going to be recommending exercises that you do that are specific to your horse's issue. That's some typical exercises we might recommend. And I have to say that like when I go back, I can tell who's been doing their exercises because the horses will get more mobile over time, or get better at engaging certain muscles. Like for instance, if I had a horse that say had a stifle injury, we might do something like a lateral tail pull that's in this photo where I'm actually shifting the horse's weight over her left hind to get some muscle activation of the quads. And some horses that are injured, those muscles really get inhibited. So we want to do the soft tissue work to relieve pain, help with inflammation and healing, but we also want to teach those muscles how to engage and how to work really well again. So, those are things that you can do in between visits that can really help your horse out.
Now, I often tell my clients after, some extensive body work, and even if I do any Graston, that if the horse is not being turned out, that it might be an idea to just go for a little bit of a hand walk. Is that something that you would recommend as well?
Yeah, I always like them to get moving after treatment. For one thing, it just like helps them integrate a little bit and feel any differences in their body after the treatment, feel any differences in range of motion, and just take it all in and feel how it feels to move. Also, motion is lotion. It's really good for them to move around after a treatment, just to help the body in its recovery and help the body get back to normal. So I always like them to move around a lot. And depending on the horse, like the specific exercises we want you to do might go out of the barn. They might go into like doing some trot poles or other like more athletic exercises, just depending on what our goals are and what like the stage of your horse's injury, or if you're just looking to move their performance up to the next level, that type of thing.
Yeah, you sent me one of these other pictures and I was like, this is a unique way to kind of set the horse up. Let me just throw it up on the screen here, this one. Here it's coming. Here it is.
This is also busy. As you can see, she's the best. So we just have, depending on what you have around your farm, you can use some creative means sometimes to get horses to engage certain muscle groups. So I've just got her on a pedestal here. And that's really good for strengthening the thoracic sling, just sort of the muscles that hold the rib cage and the front of the body up between the front legs and shoulders. So in riding horses, we really want them to be able to use that well. And if they've had, say, some back pain under where the saddle goes, or they have just like poor posture and they're sort of dropped through the base of their neck and dropped through their back, we want them to do those type of strengthening exercises. So yes, we want to release the muscles up top, but we also want to get the muscles working on the bottom to help support that. So we want to make the change with our hands, but we also want to teach the horse how to engage the right muscles as well.
So that kind of leads into a great question too, is how soon after a treatment can a horse get back into work?
Usually, like it depends. If it's a performance horse that's working and they're a fit athlete already, and we're just doing more like maintenance care and just helping them perform at their best, they're not going to need really much time off. After the first treatment, I might say like, see how they're doing the next day, maybe give them a light lunge or like a lighter ride, more of a loose, stretchy ride, just, assess out how they feel. But they shouldn't need too much time off. And like I said, I personally like them to move around a lot. If it's a horse that is recovering from an injury, obviously there might be other factors at play that restrict the amount of exercise they can do. But in your typical riding horse, like I would say at the most, if they're going to have any tenderness after treatment, it should resolve after 36 to 48 hours, and they should be completely back to normal after that. So if you wanted to stay on the conservative side, you could give them a day or two off. I usually recommend just taking them out and at least, moving them around a little bit, seeing how they're doing, see how they're feeling, and sort of playing it by ear a little bit. I think every practitioner kind of has their own approach and philosophy to that as well.
Yeah. And it's ultimately safe to use with other modalities, especially like something like kinesiology taping or, red light therapy. You can kind of use them in unison with one another.
Yeah, 100%. Like those are two really great examples of things you could do together with Graston. And like I said, for chiro, I find it really a great like addition to my chiropractic treatments. So yeah, it just depending on what you already do. There's not too much, like you wouldn't want to overtreat an area by doing like a lot of like deep soft tissue work with your hands and then maybe going in deep with Graston as well. Like you would want to be a little bit careful about how you layer on those different treatments. But for the most part, yeah, it can be a really good addition to a hands-on treatment, or like you say, some of those other different modalities, or like for me, like laser is another thing that I offer. And for sure you could do those two things together.
And then frequency between treatments. So let's say you go out and treat a horse, and then in a couple of days I go out and treat the same horse, and obviously both of us being able to do the Graston. When is too soon to do a second application of Graston?
Yeah. Yeah, like again, like everyone's a little bit different, but definitely, if you've got a couple days in between, if you're working on something that's more acute, or you really want to work through it, like that frequency of treatment might be really beneficial for one, say, because Lauren and I share some patients, we work together on cases. So say I was out doing a chiropractic treatment, and then Lauren was out doing massage a week or two later, that would be plenty of time and probably really beneficial for her to go back in and do a Graston treatment on a similar area. So yeah, like any time after, like, a week out, for sure, you could go back in and do Graston on that area. In humans, practice frequency is a little bit different. Like sometimes we'll have people in the clinic, 2 or 3 days a week. And in those patients, I might do Graston on them like 3 days a week kind of thing, especially if they're recovering from a more acute injury. So yeah, you can definitely use it more frequently, but it also it'll just kind of fit into your treatment plan naturally of when you're normally seeing that horse.
Perfect. I got a question that popped up. This is from Rosie. She says, I have an ex-race horse that has a fetlock damage to his right hind. Could this potentially be a treatment that could help? If so, which instrument would they recommend?
Yeah, so we'd probably use a variety of instruments, but the first thing we'd want to find out is exactly what's going on, so that we would want to work with your vet and find out like what diagnostics had already been done, that kind of thing, and find out like, is the horse sound or not? How are they functioning? How are they performing with it? And then, as practitioners, we're going to do our own assessment to look at their gait and how they're moving, any signs of muscle atrophy or compensation patterns, all those kind of things. So we take all that into account, and then we would decide how we want to treat it. So if it's a fetlock joint problem, and it's a more chronic old issue, and maybe there's just some thickened scar tissue in the area, or even just some like restricted joint motion, you could definitely use Graston as part of an overall treatment to move the tissues around the joint, get some good blood circulation to the area, work around into the ligaments surrounding the joint a little bit, just to again, to mobilize all the tissues in the area. So there are definitely things that you could do with Graston to potentially help, but it would depend a little bit on what the injury was and the state of healing.
Yeah, and again, the instruments are to be used by practitioners that have had the course and certification.
Yeah.
So it's up to the discretion of the practitioner as to what instrument they would use to any given situation or case. But yeah, it's interesting to see what we do use, because something that I might use, Stephanie might choose something differently. It's just different approaches, and it's all individualized with the horse as well. So
yeah, that's right. Yeah, it's a bit of an art and a science, and just making those decisions.
Yeah, but we've got our whole little bag of instruments that we can go through. So we'll do the best job we can for your horse's benefit. One of the other things, I know you mentioned it earlier in the webinar here, but the other stone that you said, it was a Gaisha or?
Oh, the gua sha.
Guasha, that's it.
Yeah. Have you heard of gua sha before?
When I posted that I was bringing Graston into my services, someone did write it on my wall, and I wasn't quite sure, so I'm not gonna lie, I did have to Google it and see what it was all about, and it was a unique looking instrument. And I'm sure it has some similar applications, but obviously Graston is very, very different in its instrument. So maybe you can just kind of let us know the differences and the benefits of them both.
So there might be some practitioners that use gua sha on horses. There probably are, actually, but it's not something I'm too familiar with myself. But it's more originating, I think, from traditional Chinese medicine. And gua sha is kind of like, it's usually kind of like a stone that has some different edges on it. So it's kind of similar in that you're using an instrument, in this case, like a gua sha stone, to mobilize the tissues. In gua sha, the main goal is to stimulate the skin and the capillaries. So you're actually really trying to affect like the blood vessel, superficial blood vessels and circulation, just by stimulating the area. And then with Graston, what we're really trying to do is more target the underlying tissues. So the fascia, the tendons, the ligaments. So there is a little bit of a difference just in sort of like the target tissue. The gua sha, you're sort of, in my understanding of it, you're using it to sort of create like a micro-inflammatory response by just like bringing blood flow to the area. Similar to like other modalities, like that's the same way that like ultrasound and shockwave work as well. They're just trying to create a little bit of perturbation to the area to get blood flow, to get the body sort of thinking about that area. But with Graston, we're never trying to break capillaries. So the way that we would use it is a little bit different because we're not really trying to use it in that like same way that we're really perturbing the blood vessels and capillaries. It's a more just trying to use some mechanotransduction to mobilize the cells in certain ways to elicit cellular response.
And are there other kinds of instruments besides the gua sha and the Graston?
Yeah, I think there's a ton out there for sure. And like if you Google it, like Graston is probably the most common and the biggest one, but there's a lot of knockoffs. And like Amazon is full of all kinds of different ones as well. But there's like different sets that are similar. And in the chiropractic world, there's quite a few different ones. There's a popular one called the T-tool. There's rock blades, and they're all sort of like different variations on the theme, having different edges and being made of different materials. The Graston is made of stainless steel and a combination of other proprietary metals that is supposed to give it a really good, it gives it that great feedback for the practitioner to feel what's going on. So that's a really good advantage of Graston. There's a ton of them out there.
That's good to know. Yeah, the Graston is the first one I've come across for the equine world. So I'm not too sure what else is out there, but I'm totally happy with my choice to take on the Graston technique and introduce it to everybody and utilize it because I see the benefits, and I think quite a few of my patients out there are benefiting from it. I know a couple of the horse owners are a little jealous that the horse gets the care, but like you said, they do offer it for the human side of things as well. So a lot of like physiotherapists, chiropractors, even maybe massage therapists will offer it. I don't know too many in the Southern Ontario hemisphere, but I'm sure they can go on to Graston and find a location close to them.
Yeah. So there, in terms of people looking for practitioners, there's very few right now because it's so new. And we've just trained the very first practitioners in Canada to work on horses with Graston. But that population will be steadily growing for sure. The next training in Ontario will probably be in the springtime. And then on the GT Equine website, if you're a practitioner looking to get trained, you can go on there and sign up for one of the trainings that's going on in the States. There's a few coming up. There's one at the end of October that I'm teaching actually in Idaho. So if you feel like flying to Idaho, you can come train with me there. There's quite a few in like Florida in some of those big equine hubs. So there's a lot of trainings going on. So like if you happen to be going down to Florida anyways, you could catch a training while you're down there for the winter.
There you go. See, I should have gone down to Florida, but I'm glad I got to go into your class instead. Does anyone else have any questions? Go ahead. There's that chat bubble or comment section. We're always here to answer your questions, whether it's related towards your horse or just common knowledge that you want to know about the Graston technique. It's one thing I guess especially this time of year, as we go from like the warm to the cold, wet, rainy, muddy, I like to emphasize to my clients that it is really important to brush your horse, not only for getting grit and debris out of your horse's coat before a massage or a chiropractic adjustment, but to use these Graston instruments as well. Yeah, see,
Yes.
everybody brush your horse before your
Brush your horse.
practitioner comes out.
The instruments are so sensitive that if there's like a layer of dirt on the hair, you could really pick it up through the instruments. So like it's always appreciated if your horse is clean anyways when we arrive. But particularly for doing Graston, it does go a lot better when the coat is nice and clean and has all the little particles of dirt brushed off.
Yeah, especially when you like think about, the Graston having that beveled edge at that, like you said, that 45 or 60-degree angle, and we're sliding it along their coat and on their skin. Can you imagine if like any little mud particles were there? That could be really irritating. But brushing your horse before any kind of treatment is a great idea too, because you might find something that you can bring to the attention of your practitioner. So it's not only to relax your horse, get your horse clean, but you might be able to detect any kind of issues or sensitivities that were there anyway. So we might as well bring it to our attention so we can see if we can help the horse out. So
yeah, that's a great point. A lot of people will say that, like, oh, I've noticed my horse is sore in this area when I'm brushing them. And that's all really good information for us as practitioners.
Yeah. So it is vitally important to brush your horses every time of the year, but more so to get that mud off right now.
Yes, we're definitely entering mud season quickly.
Right. Oh, got the rain sheet out already. I can't handle that.
I know.
Wendy says that was super interesting and informative. Thank you both. And Rio says thank you too. Thanks for attending, Rosie. Wendy. That was great. Say hello to Rio for us. Any other questions? We love hearing your comments as well, but questions are always appreciated. If not, we have our Facebook pages, we have our websites, and of course, you can find us basically anywhere these days, right? You can contact me.
As long as Facebook doesn't go down again.
Wasn't that frustrating the other day?
Yeah, it was it really made me stop and think about how much business I conduct on Facebook. And
I had to laugh because I was talking to you, and then nothing was working. Yeah. And then I got an email from you through my website that says, hey, I can't get a hold of you through Facebook, so here you go.
Yeah, it was a little frightening. I realized, gosh, I have no way of getting in touch with you. I don't know your phone number. I don't know your email. Like Facebook is it. So yeah, I had to do the old-fashioned thing and look you up on your website, fill out a contact form.
It's definitely a lifeline, that is for sure.
I know. Yeah, it really makes you stop and think when the platform goes down.
Yeah. Angie says, I would like more information on the class in Idaho at the end of the month, and how much is the class? So
sure. Yeah. So all the pricing and everything is listed right on gtequine.com. So if you go there, it's really easy to navigate and you can scroll through, you can see the training in Idaho, as well as all the other upcoming trainings. And it says like the pricing, who's the instructor for it. Like they have information on payment plans as well. So there's all that stuff right on the website, but you can also reach out to me directly if you want to ask me any specific questions.
Yeah, unfortunately, I don't have your business card. I should ask for that. And I could have done like a little bit of
I'm easy to find on Facebook. It's either through my business page, which is On Course Chiropractic. Or just by searching Stephanie Crawford. I'm very searchable and findable, and you can reach me through my website as well at oncoursechiropractic.ca. So yeah, I'm very easy to reach that way. And then if you want to send me an email, it's Steph, which is STEPH at oncoursechiropractic.ca.
There you go. Yeah, and of course, this video will be uploaded to my Facebook page, the Healthy Equine Therapies, and so you can always go and look for her too as well. Stephanie, it's Angie Gonzalez.
Okay, perfect.
Yeah.
I'll look forward to touching base with you, Angie, and then I will. I'll also share the link to this recording for anyone that couldn't see the whole thing or maybe isn't here and couldn't make it. So I'll put that up on my Facebook page as well.
Yeah. Perfect. I don't have any more questions. So last opportunity, everybody, to get your questions in. So Dr. Stephanie Crawford can answer them for you right here. But yeah, I think that's all I have to expand on. I really appreciate you coming on and helping me learn a little bit more about Graston Technique and how you utilize the instruments and how I can now benefit from utilizing them with my clients. But I'm sure we've kind of opened the doors to Graston Technique with everybody.
Yeah, we did a pretty deep dive here.
Yeah.
So we talked about a lot of different aspects of it. So hopefully people enjoyed it. And and it was great chatting with you. I really appreciate you having me on.
No, it's my utmost pleasure. It was a good one. And thank you, Stephanie and Lauren, for the interesting and informative webinar. That's from Alice. Thank you for attending, Alice. Yeah, well, we've done an hour and a half of Graston today.
Wow. It went by fast.
Pretty quick, right?
Yeah.
Very good. Well,
all right.
No other questions have come in, but like we said, you can contact us through every platform you can think of, whether it's Instagram, website, Facebook, or if you know somebody that knows us, they're more than happy to give our contact information as well. We are happy to answer any questions you have, or if you want to book an appointment with us, that is definitely on the table as well. But thank you all for attending. Thank you again so much, Stephanie. It was awesome to touch base with you. And we'll have to do this again another time.
Yes. Yeah, for sure. It was lots of fun. Take care, everyone.
See ya. Bye, everybody.